For many of us, the concept of health is defined as absence of disease. But do you really believe that to be true? As a specialist surgeon and teacher, I have come to the firm belief that true health is a balanced state between the mind, the body, and the soul. Under the Knife with Dr. Arun is an attempt to tap into the wisdom of world experts from various fields to learn practical tools that can allow us to change our own destiny. Not just in the field of health and wellness, rather in every facet of a fulfilled life. But it begins with health. Because as Emerson said, health is our first wealth, the value of which is only recognized when it is lost. Join me in welcoming another global expert in this episode as we explore some amazing self-empowering ideas today. Hello everybody, welcome to another episode of Under the Knife with Dr. Arun. My guest today is Dr. Craig Hassad, OAM. Craig and I got to know each other probably about 7 or 8 years ago, and at that stage I was with Monash University and I was exploring opportunities of doing a project in mindfulness. I was also in the process of writing my first book. And Craig was generous enough to give me his time. And not only that, I found this gentleman to be so humble and so down to earth, but he was so distinguished and so accomplished in whatever he's been doing. Craig has been teaching, researching, and has got clinical interests that include mindfulness-based stress management, mind-body medicine, meditation, health promotion, and integrative medicine. He's regularly invited to speak and run courses in Australia and overseas, and is the author of almost 11 books now, besides making an appearance in movies like The Connection. My first book that I got introduced, to Craig about was The Mindfulness Manual, which I found to be a very rich evidence-based text. And I won't say it was an easy read, but it was very dense. So I had to take small bites. And then I landed up attending his mindfulness training course because he's very passionate. He's actually the founding president of the Australian Teachers of Meditation Association. So Craig, thank you so much for taking out the time to be on this interview with me. I'm truly grateful, and I'm really keen to dive straight into asking you some questions and into having a very engaging conversation. So with that as an introduction, Craig, I want to ask you, what is the role that mental health plays in our physical health and well-being? Because we are, as a society, we are in an avalanche of chronic conditions and chronic inflammatory conditions predominantly. But now, of course, we are seeing a resurgence of infectious conditions like COVID, for example, has taken over, and we just don't know what variant is coming in the future. We just kept getting told as medical practitioners, there's a new vaccine, the 4th dose and the 5th dose, so we just don't know how many doses are coming. Can I begin this conversation by asking you, what are your views about it?
Well, Arun, it's lovely to be chatting to you, and about something as important as the mind and its impact on our physical health. So, our mental health can influence that in a number of ways. Firstly, if you consider the relationship between the temperament of a driver and their car, so how the person's driving their car, better or worse, accidents. Driving the car too hard, we know that the car's going to wear out faster. Well, it's a little bit like that with the temperament of our mental and emotional state. It can have direct effects on what's happening in the body. Can predispose us to a heart disease, to infectious diseases, to accelerated aging, etc. So there's this direct physiological effect that goes right down to the very core of our cells, even to the DNA. There's also the indirect effects, because our state of mind is central in determining whether or not we lead a healthy lifestyle or don't, whether we exercise or not, eat healthily or not, whether we smoke or use other substances or not, how we sleep at night, etc. So there's this indirect effect. There's also, when we have any conditions or symptoms, how we cope with that. how much suffering is associated with that is influenced very profoundly by our state of mind. So how we cope with whatever it is in life that we have to cope with, including physical illness, is very much affected by that as well. So there's a whole range of reasons why I tend to say that the mind is the most central factor in health, and everything pretty much follows on from that, for better or for worse.
But Craig, do you think that is mental illness, mental health issues, are they real? Now, I tell you why I'm asking. I understand emotions of anxiety, depression, and panic and all of that. I believe in some ways these are normal human emotions. We all experience that. Like, okay, we may experience in different degrees. Because one view, and reading and researching about yourself and about the subject as such, I came across this article by Professor Alan Francis, who happens to be one of the authors of the DSMR scale that is used to grade the degree of depression. And he says that these are all normal emotions. You may have obviously read about him, that he was kind of criticized about taking that view. What are your thoughts about it? And when does it start to get out of that, spectrum of physiological turning into pathological?
Well, look, I would agree. There isn't an emotion under the sun that every human being, hasn't experienced. So we've all experienced anger, fear, frustration, boredom, etc. So these are common human emotions. You take something like mood, and our moods fluctuate. Some people will have their mood set higher than others. But somebody draws a line in the sand and says, above this line, all right, below that line, not all right, that's pathology, or with anxiety, etc. So the sense of feeling a bit anxious or uneasy, but when it gets to a certain point, somebody draws a line in the sand, has a diagnostic scale and says, that's pathological, that's not. But this is the universal human experience. Some of the things it would say that it's perhaps not healthy is that it starts to influence our ability to live our life in the way that we would like to do. So it starts to negatively impact on our life, our relationships with others, our ability to function, to work effectively, and so on. And one of the other things too is, like, let's say we've got something like the stress response. Is it good or bad? Well, that really depends on the context. If you happen to be in the water, in the surf, and the fin of a 4-metre shark starts coming towards you, the fight or flight response is probably a pretty appropriate response that, if you're lucky, might be the difference between life and death. So we have the activation of this response, but it's meant to be activated over things that are actually happening in the present moment. Unfortunately, and when I would say it's unhealthy, is when we're activating that response when we don't really need it. So we could worry about a future event 1,000 times before it even happens and activate in anticipation that stress response 1,000 times before we're even in the situation. There's no shark in front of us, the shark's in here. And that activation of that response, totally out of context, even if we're standing in our own kitchen making a cup of tea and we're activating the fight or flight response over what might or might not happen tomorrow or next year or in 20 years from now, will I have enough retirement income? What if I do? What if I don't? And we're activating this response, and it can be totally out of touch with context, the moment, etc. Well, that's not necessarily healthy. And that, over the long term, can have a cumulative effect on our body that doesn't just affect us physiologically, but also immunologically and even genetically. So it really depends. So it's not that an emotion like anger it could be appropriate in a certain situation, in a context. But in another situation, it might not be, or the amount of anger we experience, the degree of it. And so evidence shows, and then a lot of it's to do whether we express these things, they're appropriate to context, and we express them in ways that we feel comfortable with. But when we're in a cycle of anger all the time, way in excess of what the situation requires. Well, I can show you study after study, risk of heart disease, cardiac events, poor immunity, accelerated aging. It's not good for us in any way.
Craig, we both agree that, your stress response or heightened stress response, as you say, has got the potential to disrupt your immune system. Do you think that has a contributory effect to us contracting the COVID infection? Do you believe there is any study done, or do you have a view, even if it is not validated by studies?
Well, what we know from decades of research into what's called psychoneuroimmunology is our state of mind through the nervous system communicates with the immune system and influences how our immune system functions. So we know from a whole range of different viruses, from influenza and cold viruses and various things, that high levels of stress, social isolation, depression, will impair immunity. Now, what that means is that we obviously need to be exposed to the virus, but when we get exposed to a virus, it either does or doesn't get through our body's defenses. It may or may not cause a clinical infection. If it does cause one, it might be very mild or moderate or more severe, and it might take longer or shorter time to get over. And what the research tends to show is that poor mental and emotional health, social isolation, feeling cut off, so anything that really affects our emotional world can impact. We're more likely to come down with a clinical infection if we're exposed to a virus. The symptoms are more likely to be severe and take longer to get over. So does the stress cause the infection? Well, no, the virus is pretty important in doing that, but what happens after that can be influenced by these other things. Now, that is not to say that every person who's having a really severe episode of COVID, it's all stress related. There's what we know is very influential in terms of COVID. The risk of having poor outcomes is obviously associated with age. And we're not talking about immunization, of course, but,
yes,
not immunized, higher risk of more aggressive disease, but also a person's metabolic health. Overweight, not exercising, we've got all these metabolic problems, type 2 diabetes, etc. So all these things that are risk factors for heart disease and dementia and cancer are also risk factors for not doing well if we get exposed to COVID. So all of these kinds of factors, family background, all these things can come and influence
as an interplay,
one way or another.
Correct. And Craig, recently I was listening to a psychiatrist who was on a podcast, and they were saying the COVID infection has been so unique that firstly, we were all sent into lockdown. So we were consuming so much media, so much social media, which only fills you up with doom and gloom. So that's the first thing. And then he said, as you correctly pointed out just now, that, we missed our social interaction because that has an impact on our immune system. We were wearing masks. And one of the ways how you communicate is through facial expression. So this psychiatrist was saying that, wearing the mask might be protecting your body, but it actually is not good for your emotional health. Now, I know there are two aspects to everything that we do, and we have to follow the rules that the health authorities have set for us. But he was pointing out that the COVID infection or the pandemic has been quite unique, that we have never experienced this sort of a thing in the past.
Yes, the amount of fear and anxiety, you often notice that, you're from lockdowns, which hopefully are a thing of the past, but, you get out your hour's walk or whatever, and you're walking past somebody and you sense some people are really open, even if they've got masks on or whatever, but really open, eyes engaged and so on. But a lot of people very downcast, almost like acknowledging other people would almost like increase their risk of getting COVID. And so very downcast, and you could kind of sense almost a palpable level of fear. And that fear was very often way in excess. And this is not to undervalue, COVID is can be a very serious infection for some people,
Correct.
extremely mild for others. But when we put it, in context, I mean, there's 170,000 people who die in Australia every year. The greatest proportion of those are from cardiovascular disease and so on. And COVID is not the only thing that people die from. And if we're going to get that anxious about COVID, we should probably get a little bit anxious too about our lifestyle and our
cardiac diseases and all that.
Fitness, heart disease, our risk of bowel cancer and everything else.
I think we've come to accept it, Craig. That's what I believe. We are numb to it now as a society.
Yes. Yeah, the arguments for a healthy lifestyle and healthy mental health, good mental health, there's a very good argument for that from a COVID perspective, but also from every other perspective in health anyway. And if COVID is a wake-up call, we should look after ourselves and we should value relationships and connection with others and the important things in life. If it's a wake-up call for that, then that's a very good thing, and we'll come out of this situation better. But if it's just all of a sudden just a source of fear and anxiety, and this is going to be what we're left with forever, then the residual effects won't be so useful.
Absolutely. Craig, I still remember when we were all of this was building up in 2020, this fear around COVID and all of that. I remember standing in a queue in a cafe and I just happened to sneeze. And everybody in the cafe just turned their heads and looked at me as if I'd committed a huge crime, So that was the level of fear that was palpable in the society. So I completely hear what you're saying.
Yeah.
I think, Craig, just carrying on that discussion that you mentioned, about how mental health and the emotions that we feel can be a normal range. I somehow have come to this sort of when I interact with the younger generation, and I've got teenage kids myself, I feel our society is becoming soft. And by that, what I mean is the level of resilience. You say something to someone, you are fearful that they might have an anxiety or they might have a panic attack or they might the responses are becoming more exaggerated. Now I may sound ancient in saying that, and I can tell you I've done my working with respect courses as a part of my continuing professional development, but I'm just feeling that sometimes you need a healthy amount of challenge to actually get you to say, what, I can have a stress response, but I can come out of it as well. As a society, this is the view that I wanted to know, what do you feel about it? Are we getting very soft as a society?
Well, yeah, look, perhaps in some ways we are. In some ways there are a lot of challenges these days. There's many different factors coming into play. The overuse, misuse of social media, for example, is having a very negative impact on the mental health and well-being of children and adolescents. I'm talking about the overuse and misuse of it, not positive use of it, which can play a positive role. Unhealthy lifestyle, poor sleep. There's a lot of things that are influencing mental health. But in terms of resilience, yes, in some ways, certainly mental health is on the decline. Resilience, there are concerns about less resilience, less ability to cope with adversity. And I guess we have to understand in some ways whether this is because we've become very comfortable in affluent environments and we have a lower and lower tolerance of discomfort. I mean, if you just think back 100 years, like, if the room temperature gets outside of a range of 21 to 23 degrees, it's too hot or too cold, whereas those kinds of luxury.
Craig, sorry to interrupt you there, but there was something really hilarious that I read. The most stressful thing for a teenager at the moment, you can guess what? It's not about food, it's not about water. It's about having 1% charge on their phone with a very weak Wi-Fi signal. That is the most stressful situation. So I don't mean to be making fun of anybody who is listening to this, who may be in that age group, but I'm just reflecting because as a parent, I see this. And I grew up at times when we didn't have internet.
Yes. So yes, in some ways our range in which we can feel comfortable is shrunk somewhat. Now, I think it's really, I mean, we all have to deal with adversity in one way or another, some more, some less. There are situations where we are in the world. So, and, you know, we've got to be very thankful for the kind of, I suppose, well-being, you know, and benefits we have in living in a country like Australia, of course. But the thing is, when we meet challenges or adversity, there's, I suppose, two ways of responding. One is avoidance, and to try and live in some kind of cocoon where nothing is outside of what I'm comfortable with or what I like or what I approve of, etc. In which case the world becomes a very, very small place. Or we accept that life presents challenges. We have to deal with different people, different views, different situations, etc. And we expand our ability to feel comfortable with challenge. So we expand our abilities rather than contract. Now, we know, I mean, in terms of anxiety, we've known a long time that avoidance of things that we to excess actually increases anxiety and feeds it. And we know that being able to carefully, gently expand, challenge ourselves, step into things that are just hardly uncomfortable, learn to feel comfortable with that, we can actually expand our boundaries. But it's probably not helpful, this idea that in some way we've got to try and avoid every kind of challenge or adversity and so on, because it's not going to cultivate long-term resilience and capability. There's probably a lot of things that are driving that.
Yeah.
And it's understandable, because, you know, we've got to, you know, feel compassion for anybody who's having a difficulty. But I think one of the things very important when we're growing up or when we're teaching children is to help children to be more emotionally aware, more able to regulate their emotions, more able to relate to others and have compassion for others as well. So I think that these kinds of things are very important in the upbringing and are going to be ultimately a better solution than just trying to wall ourselves off in a world where nothing ever challenges me or challenges my points of view or in any other way.
Correct. Craig, can I ask you, you deal with a lot of medical students, you know, and you run courses for them about building, you know, that mindfulness-based stress reduction strategies and all of that. Say in a real life example, sadly, medical students are known to have a high suicide rate as well, which is very unfortunate. But I think there are a lot of factors that contribute to it. But if I gave you a real life situation, if a medical student came to you that I'm facing these sort of thoughts, facing these kind of, you know, emotions of anxiety, worry, what is your practical advice to them to build resilience, to help them build resilience? How you did mention that don't go into a cocoon, but could you just maybe enumerate a few steps that you could suggest, or a few suggestions that you might have to help this individual who might be having these thoughts of melancholy and, you know, hopelessness?
Well, what we build into the curriculum from day one virtually is we do teach some skills in coping. Initially, mindfulness-based approaches to help the students. They learn by applying these skills to themselves, how to learn to be more self-aware, how to learn to ride those emotional waves and ups and downs, how to cope with stress, to stay present and on task when dealing with workload and challenges. I mean, the students have got a lot on their plate, you know, it's
Correct.
And of course it's what students come into the course with. So, you know, so very often high levels of traits of perfectionism and so on can leave the students very vulnerable to mental health problems and negative attitudes to themselves and their performance and well-being and so on. So we try and teach the students some of these kinds of skills. Now we're teaching this as a kind of preventive as a kind of adjunct to other things that the students could use. If a student's got major mental health problems, the core curricular teaching is not there to all of a sudden become therapy for the students. Because if a student's got significant mental health issues, as comes up from time to time, then that student needs more personalised care. They need to be talking one-on-one with a mental health professional and getting, to make sure they're getting that specialised care. Although the tutors, health professionals in themselves, but we're not wanting to confuse the teaching role with a therapist role.
Medical treatment, yeah.
Correct. They learn about other skills and strategies. They learn about the importance of healthy lifestyle, the importance of healthy sleep for good mental health, because chronically poor sleep is a major risk factor, particularly for depression. Health and nutrition. Nutrition is a mental health intervention in itself, health and nutrition. So they learn about all these kinds of things. And at the end of the day, all you can do is offer the students knowledge, tutorials where they can learn to apply this to their own lives. But at the end of the day, it's going to be the student's own personal choice.
As a part of the program, Craig, can I ask, do you have therapists or nutritionists that you direct these students to who need more one-on-one support, or you let them discuss it with their GPs?
Well, if, for example, a student comes to a tutor or writes in their weekly journals, something that obviously flags, more significant issues, the tutor might be there, have a supportive conversation, but it'll be a matter of triaging that student to see their GP or maybe the university counselling services or other professional help that they might need.
Yes.
What we've been very encouraged by is that we find that 90% of our students, from our research we've done, 90% of the students say by the end of the program that we teach them in first year that they're applying this to themselves in their own life outside of tutorial time. So they're practicing mindfulness and making other healthy changes in their life as well. So we're very encouraged by that. When we measure their mental health and well-being, by the end of the program, despite the fact they're in the high stress pre-exam period, after the program, everything we could measure about their mental health and well-being had significantly improved compared to a low stress period early in semester prior to the program. So we're certainly encouraged that the decline in mental health and well-being is not a given, that there are things that you can teach. And one of the things about teaching a health professional is, well, here's some strategies in self-care. Here's some strategies and here's some, the basics of health psychology that can help you to change your behavior and mindfulness and so on. But now you've got a foundation in understanding how to apply it yourself to one day understand how this might apply for your patients. So that we hope that we lay a foundation for students that are more interested in prevention, more interested in incorporating lifestyle and mental health and mindfulness strategies in the management of chronic conditions, and to use that along with the best that modern medicine has to offer. So the students have more strings to their bow rather than just a script pad or a surgeon's knife. There will be times when the script pad and the surgeon's knife will be exactly what the doctor ordered, but we often leave off these things that seem to be too simple and so on, like lifestyle and mental health and mindfulness.
And I often package this to my patients. I say, there is power beyond pills and procedures. So that is your own inner power. And I think that's exactly what you're talking about. Craig, I'm quite fascinated about the role of diet that you mentioned. In fact, there is a video topic that I came across not that long ago. It said, good food, good mood, which actually summarized the whole thing. And clearly, you and I have been very familiar with Dr. Dean Ornish's work. And that is actually proven to a very convincing degree that, good food can not only help you with a lot of these medical issues, weight issues, but even prostate cancer, which is like, yes, it's a sort of a slow growing cancer, but still it is a cancer. And I think he's done ongoing work on how it can affect other cancers as well. Do you have any views about a particular diet or a meal plan or anything that you believe in yourself based on your decades of research in this, Craig?
Yes, I don't think anybody's come up with the definitive final answer as the one healthy diet is this, and all other diets are poor. I think some basic principles are coming out again and again as being very important. Essentially, a whole food diet, essentially a plant-based diet, and a lot of the dietary principles associated with the Mediterranean diets seem to be associated with better health. The Ornish program, for example, quite strict vegan diet, although some fish oil or omega-3s and a few variations have been
Correct.
tweaked, but also
egg whites as well, yeah.
and some people would look at that as being, well, that's actually an anti-inflammatory diet. Very similar to the Jelinek diet for MS.
Yes.
In his Overcoming MS program. And there may be perhaps a difference in the level of adherence required to turn an illness around, like heart disease or prostate cancer that you were talking about with Ornish. Like if there's a disease already there and you want to turn it around, you probably need a much higher level of adherence to stricter dietary principles than for a person who's in their 30s and in pretty good health and there's no clear evidence of a major chronic illness. And that person might follow basically dietary principles like plant-based, whole food, low in excess sugars and excess salt, excess fats, particularly saturated fats, perhaps just so low in excess things and avoiding lots of processed foods. I don't know why we process the nutritional value out of food and pump the calories into food and too much salt, etc. But that's what we do in the processing of it. So if people are following those kinds of principles, but they've probably got more latitude for a bit of variation if they're in good health. But I think that those kinds of principles are coming out. Ornish, Jelinek, Mediterranean diet, etc. The worst diet you could have would be the Western diet, so-called Western.
No wonder they're called the SAD diets, the standard American or I don't know whether we should say Australian diet or not, but yes, the SAD is standard American diet and it's the worst diet. I totally agree.
Yes. And from a mental health, because you mentioned mental health before.
Yes.
Deakin University, for example, have their food and mood centre.
Wow.
And they and there are other groups around the world doing work in this area, but looking at the research on nutrition as a mental health intervention. And so the overall dietary quality is important, and particular nutrients might be very important as well, like having a very low vitamin D leaves somebody at more risk of depression. Now, if you've got a healthy vitamin D, taking more vitamin D is not going to make you happy and happier.
Yeah.
But if you're deficient in it, it'll be hard to get a good therapeutic outcome unless that deficiency is restored. For example, omega-3 fatty acids have got some good evidence as well. But it's the overall dietary quality. And so when people have got depression, improve their diet, or indeed improve their sleep, or improve their exercise, etc., then there seem to be positive effects on their mental health, particularly with depression for diet, more so than anxiety. That's what the evidence seems to show at the moment.
Yeah. And I think, Craig, when I was researching for my first book, Happy Gut, Healthy Weight, I was so fascinated to find that being a GI surgeon myself, I didn't recognize until the time I got into the research, there is a very strong gut-brain axis. And when you change your whole food diet into a whole food plant-based diet predominantly, you change the gut microbiome, and that affects your gut-brain axis. And people who have got poor gut health have got this condition called brain fog, which is the inability to focus. I didn't recognize that link until I got into the research and then got so deep into the research that was so fascinating that I had to try it on myself first. And the first thing you realize when you start eating clean is you just think more clearly, which is so fascinating.
It is. You see, when you make one healthy change in your life, there's a whole bunch of side effects. We might do it for one reason, to lower risk of heart disease or something else. So changing one thing. But when you change one thing for the better, you actually change it for the better in lots of other ways as well.
Yeah, I
So
call it the ripple effect, actually. Yeah, there is a ripple effect in all areas, isn't it?
that's right. So when we add one risk factor to another, we get this exponential increase in risk of pretty much any chronic condition associated with aging. But if
Mm,
you flip it the other way, every time we make one improvement in our lifestyle,
yes.
exercise, diet, etc., then we can get this significant reduction in risk of just about any chronic condition we care to name. And
Yeah,
it's not just living longer, it's living longer, healthier. But of
correct.
course, sooner or later, the body will get ill from something or other, and the body has to age eventually.
Mm,
But how fast it ages,
yeah,
um, that is much more in our control than we often think.
yeah.
And so we
And
can be active participants in our own healthcare
yeah.
if we choose to.
Correct, correct. And what you're referring to is really, talking about improving and increasing our health span, because the modern medicine has given us tools to increase our lifespan, but I think it's the health span that we are trying to expand.
Hmm. Well, yeah, and the big letter items, when you look at the research on the risk of getting chronic illnesses associated with the basic lifestyle factors, being obese or not obese, smoking or not smoking,
Mm,
doing some regular exercise or not, eating a reasonably healthy diet or not, drinking too much or not. When you look at those things, if somebody can tick those boxes, we're not talking about being a health nut, but just at least,
correct.
satisfying, then much longer life expectancy,
Yeah.
more than any pill we could take, and healthier life as well. If we can't tick those boxes, then whatever chronic illnesses are going to come our way, they move forward. We move forward the date
Yeah.
when we're going to meet those illnesses.
Yeah.
And but even then, as you mentioned with Ornish,
Yeah.
and Jelinek is probably the other lifestyle program, although that's basically been focused on MS, but they're very similar principles.
Hmm.
But even for those chronic conditions that are thought to not be reversible,
Yes.
that a person really undertakes in conjunction with their medical care,
Hmm.
but undertakes significant lifestyle change, even those conditions seem to be reversible. So the body has incredible powers of repair,
Reverse.
of regeneration, and so on, but we've got to give it the right conditions to do that well.
Yeah.
And yeah.
And I think, Craig, part of the right conditions, a lot of people that I come across, who are into a particular diet like paleo or keto or all of that, whether it's related to, weight loss predominantly, because dieting is related to weight loss, as our society sees it. I feel the emotional state plays a huge role, as we discussed earlier on. Like you have to have almost like this integrative approach to reversing disease if it is already established. Prevention is different, but if there's already reversing disease, if disease already set in, you've got to go all in and, as they say, put sort of, the full foot on the accelerator. So on that note, Craig, can I ask you, what advice do you give? Because you give advice to integrative medical practitioners. You are a believer in the whole integrative approach to treating individuals. What are, just broadly speaking, what are the aspects you discuss with integrative medical practitioners on what needs to be touched upon when they are dealing with individuals with chronic health conditions, let's say cancer, for example?
Yeah, I love acronyms, Arun. So anytime
Good way to remember things.
that's right. So the essence of health, and the essence of health is firstly education. And I'm not just talking about go to school or university. I'm
Yeah.
talking about being educated about health issues, but
Yes.
also being educated or knowing ourselves better. Because we know certain things are good for us, but we don't do them. Or we know some things are not good for us, but we keep doing them anyway. And so we've got to understand our own minds and motivations. We've got to know ourselves better to be able to make healthier choices. So education, stress management. So that's the whole mental health, mindfulness kind of area. Spirituality. So that's where do we find meaning and purpose in life. Exercise, nutrition, connectedness, so that's social support, relationship, sense of community, and environment, the importance of a healthy environment. And I'm not just talking about, like pollution and so on, all of that's very important, but getting out into green environments.
Correct.
For me, going for an early run, if exercise was just running on a treadmill in a gymnasium with loud music thumping away, that would be my idea of a living hell. But for me, getting out and running along, paths along Melbourne's waterways and through parks and, urban areas and so on, me getting out early in the morning, the elements, and it doesn't matter if it's raining or not, for me, that environment, I find and the seclusion and the quiet of it, for me, is very renewing. But the importance of a healthy environment. And so that's the essence of health. And that's the essence of preventing chronic illness, or those elements integrated into the management of chronic illness. So that's what I tend to emphasize.
And that's the basis of your Essence program as well, isn't it?
That's right.
That's right. Yeah. In fact, I want to just remind the audience, if they haven't already done so, there is an amazing, that was my first book that I read, written by yourself, Craig, Know Thyself. And it was like, a small but not a slight read. It was really insightful, I must say. And it was one of the first books, I must confess, that got me on this journey of, who am I? Why am I here? Purpose, know thyself, So you really have written it so beautifully to convey that message in a very impactful way. And I must also acknowledge you, Craig, that, with the Essence program, you bring about the effect of the final E, which is environment, which a lot of us medical practitioners, we underestimate, we underrate it. And I think that is so important. One thing that I found, and I read books on minimalism, is that, clutter creates cloudiness. It clouds your thinking. It takes away the clarity of your thinking. And when you are thinking in a cloudy way, you just make reactionary decisions. And that was so powerful, So I think what you're saying, and you've summarized it so beautifully in the acronym, I'm going to borrow that and I'm going to quote you on this. That is really fascinating. So Craig, just coming towards the end of it, but I want to just touch upon this topic of spirituality that you mentioned. And spirituality and consciousness, to me, are quite interlinked. Do you think we are, as souls, as individual souls who are seeking meaning, we are seeking ways and means to grow our level of consciousness? What is your view about it, and how can we do it in a meaningful way without joining cults and organizations and trying to fight and argue with people?
Yes. Look, I think this is probably one of the big questions. I'm not sure if there's a bigger one, but
there are more coming, actually. I'm just joking.
Yes, when I was a teenager and I found myself getting anxious about an upcoming event, feeling anxious, and the body was, and I can remember having this moment of all of a sudden noticing what was happening in my body, but also noticing what was happening in my mind, is that there was an imaginary me living this future event and wondering how it's going to go. And all of a sudden I realized I'd been in a dream world. And up until that point, I hadn't actually realized I was in a dream world. And as soon as I saw that I was in a kind of a mental dream world, and I just came back to the present moment, like became more aware or conscious of where I was, the whole stress response switched itself off. And I thought, that's interesting. But I mean, as a 15-year-old, I didn't have the language for it. I didn't have the science for it. But the fascination between consciousness, what we give our awareness or attention to, what's going on in the mind, and whether it's awake or in a dream world, and what happens in the body, that was intimately linked. For me, it was like an aha mind-body moment that obviously was one of the experiences that set a path in life for me. All the wisdom traditions talk about the importance of waking up. For me, that was a moment of awakening, but there are different levels of being awake or aware. And to be awake and aware enough to actually be conscious of your connection with the whole universe and so on, That would be good. That's a work in progress for me, but definitely something that gives a lot of meaning to life and connection with others and meaning to work. But yes, to actually wake up, what does that mean to wake up? So I think that's the ultimate question. But just from a practical point of view, in terms of our mental health and our physical health, just a bit of waking up has quite a profoundly positive effect. But mostly we're living on a lower level of awareness, not even aware of what's going on in our own minds, what's driving our behavior, etc. So, and in my experience, ignorance is not bliss, and I'm trying to kick the habit.
Yeah, that's so true. But in fact, Craig, the interesting thing is, and I include myself in this category, that for many people, it takes a level of adversity to hit them for them to wake up. Do you think there is definitely, like, what I'm meaning to ask you is that does it always have to be this, that we have to experience adversity to actually wake up? Like from your example, you were a 15-year-old, a teenager. You could be having parties with your friends and all of that, but you actually had that insight, that aha moment, that you were actually creating that response just by your imagination. So that I think in my eyes at least, you were already quite ahead and quite evolved to be able to actually recognize it. So just asking you, why is it that for majority of us, they have to go through an adversity to actually wake up?
Yeah, I would like to really, really wake up without adversity, but often I find that I need a bit of a nudge, sometimes a push, or sometimes to be hit over the head by a piece of 4x2 to actually get me to wake up. And I suspect others are a little bit in the same boat as well.
Yeah.
We don't have to have adversity to wake up, but often the complacency, the comfort, things just going along, automatic pilot, we kind of just go off into a little bit of a world where we're not living our life really present in the moment. We're just going kind of through the motions a bit. And so adversity, in my experience, it kind of hurts like hell when you're going through a bad patch. I can remember, second year medicine and everything. I was just, somebody waved a diagnostic scale for depression under my nose. I reckon I could have easily tipped the scale for a diagnosis there. I don't know, but I kind of taught myself principles that I would now call mindfulness and practiced intuitively what I would now call, open monitoring form of meditation, but it went very deep for me. But I guess they were things, the adversity, and I'm with Shakespeare in this. Sweet are the uses of adversity, which like a toad, ugly and venomous, wears yet a precious jewel in its head. And so this adversity can be used well if we turn towards it, pay attention to it, learn from it. And that's not easy. And it hurts like hell when it's happening. But if we use adversity well, they're often, in retrospect, the best times in our life from a growth, a wisdom point of view.
Yeah. And Craig, you know how I package it is, it's actually the title of my latest book. It's called Your Mess Has a Message. So I think, and that's what we sort of, need to look at it, because it can either take you down or it can really take you up. So Craig, can I say it's been such a delightful interview. I've got 3 last questions that I ask all my guests. They're really like rapid fire kind of a thing, but it's just something that summarizes the essence of this conversation. So if you allow me, I'd really love to ask you these 3 questions, Craig. The first one is, what is the one habit that has got you to where you are today, Craig? Besides meditation, of course, we all know you're heavily into meditation and mindfulness practices. But is there any other habit that you can say, this is the number one habit besides mindfulness meditation? What would you say that would be?
I was about to say meditation.
Well, I took that away from you.
Yes, that's right. that more than anything else? Well, let's say just waking up, whatever you use to wake up, but waking up.
Right, right. Awesome. That's good.
I'm going to keep these answers very short for
Yes,
you.
yes, absolutely, absolutely. The second question that I ask again, everybody I ask these three questions is, what are your three truths, Craig? Your three top values that define you, who you are, and that is your essence. What would you say?
Well, everything is one. Seems to be, multifarious, but everything is one. And so therefore we're
everything is connected,
interconnected with everything else.
Yes.
And having consideration for others is just an extension. So compassion or care, support of others is a natural extension of that oneness, which is a part of life. And I'm not just talking about humanity, I'm talking about all life, and indeed the whole universe in the end. So I'd say that.
Awesome. That's good. And the last one is, Craig, what is your, let's say if all the work that you have done so far, the books, the programs, everything that you've written is taken away. And if we said, what is your one message, Craig, to the world? What would you say that would be?
Let it go.
Oh, that's so powerful. That's the book title of David Hawkins' book, Letting Go. It's really powerful. It's a very hard thing to do, but Craig, I can't thank you enough. You've given me your time, but more importantly, you've given the audience, including myself, your wisdom, your essence of all these learnings, right from a teenage person and till now. And of course, the beautiful work that you continue to do that inspires so many of us. I have truly been regarding you as one of my teachers, mentors on this journey of my own, knowing my own self, So I thank you from the bottom of my heart, and I wish you a lot of luck and strength and courage to keep forging so that you can continue to inspire many of us.
Thank you, Arun. It's been a real pleasure to speak to you and to all of your viewers.
Thank you so much.